Okay, so today I'm going to talk about the sickle cell disease and what are the manifestation they would present. Okay, so I talk about the pathology just for trying. I talk about the pathology of sickle cell disease, and today I'm going to talk about the signs and symptoms of sickle cell disease. So first of all, if you remember, and the main thing you should remember first of all that this manifestation will start at 6 years, 6 months. Why? Because of the conversion of hemoglobin F to hemoglobin A. Why? Because hemoglobin F have alpha and gamma, and hemoglobin A have alpha and beta. And our defect is in chromosome 16, which encoding for, chromosome 11, which encoding for beta chain. Now the sign of the sign will start at 6 years old. All right, and I think you should remember, okay, that 6 month, okay, as anemia and vaso-exclusive. Okay, so 6 month, this is a baby. He will present with anemia and vaso-occlusive crisis. Okay, so anemia symptoms, the mother will complain of, like, she saw her let's say her baby, that he's having pallor, jaundice, fatigue, anorexia, irritability, dizziness. Okay, and the doctor has made some examination, and he find that this patient is pallor, underweight, jaundice, and hepatosplenomegaly here. Hepatosplenomegaly. Okay, now the first thing, let's say that this baby let's say he come with the signs and symptoms of vaso-occlusive crisis. Okay, so what is happening basically is that your RBC, as long as they enter inside these here inside the blood vessels, see, they are normal, right? But in sickle cell disease, they change their shape. Okay, so as long as they go to small capillary, low oxygen, okay, they will become sickle cell disease, and then they become again, when they go to good environments, they become spherical shape, and then again they become sickle cell, and the cycle will repeat itself. So this will convert from reversible to irreversible change to the membrane. All right, so this is a key point you should remember. Now, so basically, there will be episodic attack of ischemic pain and infarction of the various organ. So imagine that this baby is suffering from pain that results from ischemia and low blood supply to an organ. So why? Let's say he was having infection, he was having fever, dehydration, acidosis, oxygenation. This thing will change the RBC shape, and that will lead to vaso-occlusive crisis. Now, now they can involve many areas. So let's start with for example, let's start with the abdomen. Okay, so they will lead to splenic infarcts, and then they will lead to they will lead to also a damage to the kidney. They will affect your brain. Okay, and they can also affect the joints and produces pain, bone, and lung, which is producing acute chest syndrome. And they can affect the penis, and then they will cause the painful uncontrolled erection, which is known as priapism, because of the infarction. And they will cause also manifestation on the, yeah, many organ. Okay, but these are the main. Now when it's affect the bone, they will lead to bone pain, and this is the most common site, or the most common site where the vaso-occlusive effect will occur. When he come, you have to give analgesia, hydration. In severe cases, you will give narcotic drug like morphine. Pethidine you not give. You will have codeine and other things. All right. So let's say it affects the renal. It will present with microinfarction, and the kidney will have a lot of microinfarction, and thus will lead to hematuria. Okay, and we mentioned before that in sickle cell traits and sickle cell affected person, he will both of them, they will not be able to concentrate the urine, and this will lead to because of the effect of hypoxia in the medullary region of the kidney. Aplastic crisis is a condition in which you are having a, they are chronic hemolysis, right? Okay, so because there is chronic hemolysis, the body is dependent upon the bone marrow to produce the RBCs because there is chronic hemolysis. Okay, now let's say you are having infection caused by parvovirus B19. Okay, this infection basically will affect your bone marrow and thus will lead to affect the stem cells, and then there will be no any erythropoiesis. So there will be severe anemia, hypovolemic shock, and other things. This is only treated via the blood transfusion. Okay, and in the finding, you can find a very low hemoglobin, WBC might be normal or low, platelets also might be normal and low because remember pancytopenia. Okay, then you will have acute splenic sequestration. This is a very important and very severe complication in which the sudden enlargement of the spleen due to the pooling effect of the food inside it. So this is your spleen. Too much blood inside lead to splenomegaly, and basically this will caused by the pooling of the food inside the spleen. This condition basically will present with pain, tachycardia, pallor, and cardiovascular collapse. So physical examination will lead to hypovolemia. Now I think I've mentioned that you will find hypovolemia in aplastic crisis, but this is not true. You will find it here, okay? Because there you will only find a very low account of blood cells. So you will have here hypovolemia and splenic is massively enlarged. So hemoglobin is very low, but the reticulocyte is high. So there will be no damage to the bone marrow, so there will be high reticulocyte. And the platelet is low, but the WBC will high. Again, the bone marrow is not affected. Treatment via the blood transfusion after collecting the hypovolemia. Okay, and now during 5 to 36 months of age, usually the spleen, because of the repeated infarction that occur because of vaso-occlusive, it will lead to shrinkage and fibrosis. Okay, you should know this. There will be shrinking and fibrosis of the bone marrow of the spleen. Okay, and this will lead to loss of the function of the spleen, which is basically an example of the function is the fight of the infection of encapsulated organism like pneumococcal, meningococcal, and influenza B. That's why we have to give at birth. We have to give a Prevnar 13-valent pneumococcal vaccination, and at 2 years old we will give also polyvalent vaccination. Now, cerebrovascular accidents here, they will basically, because of the vaso-occlusive effect, it will lead to headache, blurred vision, convulsion, maybe unsteady gait. All of these are signs and symptoms of the cerebrovascular accidents, which basically are very severe, which require hydroxyurea to prevent it. Now, the acute chest syndrome, they will present with cough, okay, with fever, pleuritic chest pain. Now, this is also because of the vaso-occlusive effects, and they might present with infiltration, because some people say that it is associated with infection, which is pneumonia. They will be treated via the hydroxyurea also as a preventive treatment, hydration, exchange transfusion. They will not put exchange transfusion here. This is the first line of treatment, and analgesia and other medications. Also, they usually give antibiotics like cephalosporin, third generation. Lastly, priapism, I talk about it, and the eye could be affected with retinopathy and blindnesses and hemorrhage. Avascular necrosis will occur in the femur because also femur normally have low blood supply, And there will be papillary necrosis of the kidney, and there will be leg ulcer here less commonly. They will affect osteomyelitis, which is basically affected by salmonella. And hydroxyurea disease, hydroxyurea medicine, all يعني they give for cerebrovascular accident, for acute chest syndrome, as I mentioned, for periamphism, or for avascular necrosis, and for recurrent vaso-occlusive, which is the condition in which there is a severe symptoms. I think I talk about everything, but there is something known as dactylitis. This is occurring. This is the first manifestation, maybe in children with sickle cell disease. Hypostenuria, I talked about it before because of the hypoxia of the medulla, and there will be autosplenectomy in 5 to 36 months, and there will be gallstone because of the hemolysis, and there will be also pulmonary hypertension because of the effect of the closure of the circulation, heart failure, okay, because of anemia, and yeah, this is all about it. If you have any question, feel free to ask.